let's have a look at some of the common things that we see in terms of injuries. Now, I haven't gone into specifics in terms of actual conditions, but we'll talk about the musculoskeletal side of things and things that we see. So, when you're dealing with, say, muscle injuries, you may deal with um, things on a chronic or acute basis. So, chronic basically means something that's been going on for a long time. There may be an element of stiffness, tightness, fatigue, and issues with conditioning. Whereas the acute things tend to happen much more suddenly. So, there's a sudden strain or tear of the muscle. And depending on which classification you look at, there's three main areas. So, things like a grade one would be a strain, grade 2 would be a partial tear, and grade 3 a complete tear. Now, I think it was not last year, but the year before, I saw a series of quadriceps tears. So the quadriceps is the thigh muscle, and in footballers. So and there was this injury pattern that was developing. They were all kicking, or they were blocked. They were blocked while they were kicking, and they all developed this sudden pain in the quadriceps and so on. And so over the series of patients, we developed a protocol in terms of how to get them back to play much quicker, how to expedite recovery, and how to try and prevent injury in the future. So when you do get those things, it's nice to be able to evaluate, sit back and think about the cases. And I think if any of you are interested, I do have a talk that I've put together on that. So I'll you can have a look on my YouTube channel later on. Tendons. Now, I guess if some of you are doing biology, you may have come across things like tendons. So, tendons are basically a connection between the muscle, which is the motor, the functional unit, and the bone. And this tendon is a way that the force gets transmitted in a more consolidated way. As you can see, the tendon, although it's a big structure, has lots and lots of different fibers. And it's a little bit like a fiber optic cable or like a or electrical cable in that there's this big bundle of the wire is quite thick and wide, yet the fibers individually are quite small. And as a result, the force gets transmitted. Now, tendon injuries are very, very common in sports, and it can be anything from, a reactive tendon. So if you have a normal healthy tendon and you do excessive load, you go to a reactive, and then you go to into a tendon of disrepair. And at any point, actually, you can get a tendon tear. So in the image here, we have an example of an Achilles tendon. So an Achilles tendon tear can happen with sudden force or sudden push off. And there can be this sudden popping feeling. And often patients describe like they've been hit in the back of the leg. Depending on the patient, depending on the type of injury as well, they may undergo a surgical repair. It may be something that's dealt with without surgery, and you just keep them in a boot. But often it's the case that they will have had this some element of reactivity or disrepair. It's very unusual for somebody to suddenly get a tear without having any background issue. Now, on the other side here, you can see I've got underloaded tendon. Now, this is somebody who's maybe not so physically active. And what will typically happen is if somebody doesn't do so much exercise, they go into an underloaded phase, and then it shifts everything to the side so that when they start doing physical activity, the threshold for this reactivity and disrepair is somewhat lower. And this is what a typical Achilles tendon might look like on an ultrasound scan. So here we have a thickened, you can see this swelling in the Achilles tendon, and then you get this phenomenon of increased blood flow because of the inflammation and everything there. So this is where musculoskeletal ultrasound is very, very useful to physicians who work in musculoskeletal and sports medicine, and this is something that we do teach and train a lot in sports medicine. Another area that we deal with a lot is bone injuries. Now, when we talk about bone injuries, of course, if you have a healthy bone and then you have a collision or you have some sudden trauma, you'll develop a fracture. Now, depending on the nature of the fracture, if it's out of place, if it's angulated, then you may require some sort of surgical correction. But for the most part, some fractures don't require that. They just require immobilization and a period of time for the fracture to heal. Sometimes, when you have a healthy bone and you put it under undue stress, you start developing a bit of a stress reaction. So, the stress reaction, I describe it as if you take a pencil and then you bend the pencil and you see those little lines appearing in the pencil. That's a stress reaction. And then eventually, if you push it too far, then you get cracks appearing in the pencil in the bone, and then you develop a stress fracture. Of course, there are a multitude of different risk factors that can lead to this. So it could be that you're just doing things in a funny way and you're putting a load through it that the bone doesn't like, or there may be underlying risk factors as well. And as a physician working in sports medicine, you have to be attuned to these things and be able to kind of uncover things as well. So, important risk factors may be things like the form, so the type of exercise or how you're doing the exercise, the surface that you're running on, so say, or moving on. So, say you're a runner, are you running outside on the concrete, or are you running on a treadmill, which has a little bit more give, or a running track? Maybe it's about frequency and load and recovery. And there are other common things, well, not common, but there are other things that we need to think about in certain demographics. So you may have come across something called the female athlete triad, which was here we have menstrual dysfunction, issues with bone density, and reduced energy intake. But actually, what we have discovered over time is that actually female athlete triad is only a small part of this, and relative energy deficiency in sport is prevalent in male athletes as well. And male athletes are also at risk of developing these bony injuries and different things. The relative energy deficiency in sport can affect all sorts of systems, as you can see. So, not just menstrual function and bone health, but it affects your metabolic health, your growth and development, psychological well being, and so on. And so, um, this is something that if you're working with athletes or anyone who exercises to a very high level, you should be aware of because it can be profoundly detrimental to performance and health. Now, one of the common reasons that this can happen is in people who take part in distance running, but also aesthetic sports. So things like gymnastics or synchronized swimming, where there's this pressure to lose weight and to maintain a high level of exercise while having insufficient calories to replace it. And so it's also how the individual develops the mindset. So they keep wanting to lose weight, lose weight, lose weight, lose weight until they feel that they're perfect. Except at that point in time, they're at very high risk of developing injuries as well. And so relative energy deficiency in sport is a very, very important area in sports medicine, and actually, we know that now it does affect many, many different areas, not just performance, but also in terms of your cognitive state, your mood, and so on. So, uh, if you do have uh, uh, if you do develop some of these kind of the consequences of Reds, it would be something that we would look into to investigate further. Okay, so I digressed a little bit there from musculoskeletal injuries, but coming back to it, we have ligament injuries. So ligaments, very, very commonly injured. Here we have a nice fat swollen ankle after somebody has sprained it. And again, much the same as the muscle injuries, we can very simply grade it into three areas. So uh, one is a very, very small disruption of it, and really you can't see very much on a scan or an ultrasound. Grade two is where there's partial tearing and there's more laxity, and grade three where there's a complete tear. There may be quite a lot of swelling, bruising, and laxity of the area as well. So Yeah, so that's ligament injuries, and ligament injuries can happen all over. So it could be not just the ankle per se; it could be in the knee. So you've probably all heard of ACL tears. So when somebody pivots and injures their knee, they can get this popping and snapping of the ACL. You can get it in other structures around the knee, such as the medial collateral ligament, which is common with bad tackles. And even around the elbow as well. I've seen a lot of tennis players with ligament injuries before, and often it can be misdiagnosed as tennis elbow or golfer's elbow. But when you look at it a little bit more clearly, there's a ligament injury as well. We also deal with things like joint issues. So, joint issues can happen all over the body, whether it's in the back with the facet joints, whether it's in the limbs, and these things can happen from the sport that the person is taking part in. Again, looking at their running form, looking at the strength, or if there's any deficiencies there. It may be because they're just not having enough time to recover, so that they've got a very high training load, but they're not allowing themselves to recover, and so they keep putting more load on them, and as a consequence, like I said before, with those stress fractures, you can start to develop wear and tear so much more frequently in those areas, and sometimes when we are dealing with the uh, these joint issues, we have to obviously deal with the current symptoms, but also try to unravel how this has happened and how we can prevent it from rearing its head moving forward. And this is just an example of how somebody's normal knee looks, and then also how worn out knee looks. So you can see there's very minimal joint space between the femur and the tibia here, and there's this irregularity and sclerosis, so there's thickening of the bone that's sitting around it. So depending on how symptomatic somebody is, you may have to look at different treatments accordingly. And then for me, an area of interest is nerves because it fits in well with pain. And nerves can be injured by compression, by stretching, by impact on the nerve, and it can cause a whole variety of different symptoms, from ranging from tingling and numbness to loss of joint sensation as well, and it can also lead to things like weakness and loss of reflexes. Because, personally, I did a lot of cycling in the past. I undertook a little review, with, colleagues, and actually, Ivan was a undergraduate student at the time, and, so we looked at, nerve injuries in cyclists, and actually we found that while there has been some work done, in it before, there's still more that needs to be understood in terms of prevention, and quite often, because of that pressure and the prolonged, compression of the nerves in the wrist, cyclists can develop carpal tunnel or ulnar nerve issues. And so we did this narrative review to summarize the evidence and share more with people.